We continue with diagnosis according to Zanfu organ patterns. This time we talk about damp heat in the large intestine. This pattern will frequently be combined with other patterns, usually spleen and stomach imbalances. What makes this pattern difficult to treat is that there is yin and yang pathogenic factor which are bound together. Exactly how the symptom picture manifests will depend on which of these two elements is dominant. Damp heat in the large intestine will be defined in an 8-principle diagnosis as an interior excess heat condition. The pattern can arise when there has been an invasion of exogenous damp heat, for example, after ingestion of spoiled food. In this case, it will be a purely excess condition. Usually, however, the pattern arises in the background of spleen-Qi deficiency or spleen-Yang deficiency conditions. This makes the situation more complicated because there will be a condition of interior excess heat that has arisen from a concurrent interior deficiency condition, which will in fact be an interior deficient cold condition if there is spleen-Yang deficiency. This requires a treatment strategy that will require both tonification and draining at different stages, as well as the clearing of heat and the warming of yang. Diet plays a significant role in this pattern. The diet itself can directly create damp heat when foods that create dampness and heat are excessively consumed. The diet can, though, also create imbalances in the middle jaw that subsequently result in the generation of dampness. The damp stagnation will then begin to ferment or combine with an existing heat condition. This is typical when liver Qi stagnation heat is also present. The pattern can also occur after consumption of foods that are spoiled or infected, for example, with salmonella. Summer heat can directly invade the large intestine and create damp heat. Worry and speculation can bind and weaken spleen Qi, leading to dampness, which can then transform into damp heat. Anger and frustration can create heat or stagnate liver Qi, which then invades spleen. Symptoms and signs. There will be diarrhea, frequent defecations. Stools are sticky, malodorous, and possibly contain blood or mucus. Defecation may be explosive, stinging or burning sensation in the rectum, abdominal pain that is not alleviated by the passing of stools. There will be abdominal bloating. The abdomen feels tight or distended when palpated, dark and scanty urine, thirst with no desire to drink, fever, feeling feverish or an aversion to heat, heaviness in the body. Tongue is red with a yellow sticky coating on the root, possibly with elevated red papillae on the root. Rapid and slippery pulse, possibly full in both sure positions. Key symptoms are diarrhea with strong smelling, sticky stools with yellowish, sticky tongue coating. Treatment principle: drain damp heat from large intestine. Points: LI 11, stomach 25, stomach 27, stomach 37, stomach 44, spleen 6, spleen 9, bladder 22, and bladder 25. If there is blood in the stool, add spleen 1 and spleen 10. Needle technique: draining, moxa on spleen 1. LI 11, stomach 25, stomach 27, stomach 37, stomach 44, and bladder 25 drain damp heat from the large intestine. Spleen 6, spleen 9, bladder 22 drain dampness. Spleen 1 and spleen 10 stop bleeding. If there is damp heat in the large intestine, the patient should avoid consuming food and beverages that create dampness, heat, or damp heat. Deep-fried foods, alcohol, hot spices, dairy products, and sugar should be avoided completely. Damp heat in the large intestine can be caused by spleen Qi deficiency, spleen Yang deficiency, food stagnation, invasions of pathogenic Qi. Damp heat in the large intestine can result in spleen Qi deficiency, Qi stagnation in the intestines, and blood stagnation. Thank you. Okay, but before we end, let's summarize damp heat in the large intestine. So etiology is excessive consumption of hot and greasy foods leading to stomach heat, damp heat in the stomach and spleen, emotional problems like prolonged anxiety and worry leading to spleen Qi deficiency. Possible presenting condition would be dysentery, colitis, Crohn's disease. There will be diarrhea with abdominal pain, incomplete defecation, mucus and blood in the stools, stools with an offensive odor, burning sensation in the rectum, tenesmus, scanty dark urine, sweating, thirst but no desire to drink, heaviness in the limbs, bitter taste. Pulse would be slippery and rapid, tongue red with a sticky yellow coat. Treatment principle, clear heat, disinhibit dampness, resolve toxin. For acupuncture treatment, we have spleen-9 to resolve damp in the lower burner, as well as bladder 22, stomach 27 to promote urination, bladder 25 to clear heat from the intestine, REN 12 to resolve dampness, stomach 44 to harmonize the intestines, spleen 6 to resolve damp in the lower burner, stomach 25, stop diarrhea, REN 6 to regulate chi in the lower burner, LI 11 to clear heat, and stomach 37 to clear and disinhibit damp heat. Needling is using the drainage method. We can add moxa. Thank you for your attention.